Welcome back to AgriTalk. Today we are talking about rabies and why it is important to prevent rabies and how is it spread. So with me today we are now joined by Dr. Daniel Kese, who is the County Director of Veterinary Services, Makueni County. Karibu to the show, Dr.
Thank you.
Let me start with you. How bad or how is it in Makueni County?
Makueni has been consistently reporting cases of rabies for a long time, and of course it was part of the larger Machakos district, which was among the first districts to be endemic in rabies, and it has continued to spread all over the county. I think the three counties of Machakos, Kitui, and Makueni are some of the endemic counties. But over the last few years, beginning 2015, we have been running a program of trying to pilot what I'll be probably talking about a bit later, the national strategy. And therefore, one of the things that has happened as a result of that program is that there is increased awareness in rabies in Makueni, and that has also increased the reporting. So it would probably appear like there is a slight increase in rabies, but I would attribute that to increased awareness. People are reporting more, so we are sampling more.
Okay. Have you lost lives before to rabies, especially human life?
Human life, we may not say we have what could have been confirmed as a death caused by rabies, but in animals we have lost quite a number. Yes, we have lost animals, dogs. You know, when they become rabid, they have no chance. If they are not vaccinated, they will die within 2 weeks.
Okay. Dr. Mbaire, maybe you can give us symptoms of a human who has been infected by, how can I tell someone has rabies?
Wow. So before I talk about the clinical signs, let me share how it gets there. So I'm bitten, and I think it's a problem with all of us and medication. I'm bitten. I do not know any history about the dog that has inflicted the bite. So I'm supposed to take 5 doses. I go for the first one, the second one, then the wound has healed, and I say, I'm done. Nimepona. It's just the same thing that happens with antibiotic prescription. So you have a 5-day dose, and then by the second day you have a throat infection. Then you take 2 days and you get healed. You say, I don't need to complete the dose. That is what also happened in human. When you don't complete the 5 doses, there is a likelihood that you're going to develop rabies if the biting dog was rabid. So the things that you'll see, so it causes brain inflammation. So that is what we call encephalitis. And most of the time it is confused with meningitis and cerebral malaria. So that person becomes very aggressive, very aggressive. You know me to be very calm, and the next time you see me, I'm fighting all over. I do not want to see anything. I'm fighting everything. And then there is hypersalivation. And this person does not also want to see water. They become hydrophobic. They do not want to see water because the rabies virus will affect these muscles. So they are not able to swallow anything, so they will hypersalivate. And they also fear of air, like fresh air. They fear that. And eventually, like 7 to 10 days, this person will die of cardiopulmonary attack.
Okay. So how long do I have from the time I'm bitten to the time I get vaccinated?
I mean, you should go immediately. There's no time for waiting. As in, if it takes time, it's okay, you take your time, but you're supposed to be vaccinated immediately.
So I cannot be bitten and I say, I'll go tomorrow.
No, it's fine. For your journey, you can go tomorrow, but not saying a whole week, 2 weeks. No, you're supposed to do that immediately. But first things first, make sure you wash that wound with running water. It saves your life.
Okay.
Yes.
Doctor, when we talk about counties, we know agriculture is a devolved function. But one biggest problem that we've been having is lack of extension officers. How do you pass this information now from your offices to the people on the ground?
Makueni County, we have been a bit lucky in terms of rabies. In that, as I said, we were a pilot county for a national rabies elimination plan, which is driven by the national government, and for that reason, we did a number of things during our rabies pilot program, including with a bit of training, a training component on what Professor here was talking about, training of the children, the young ones in primary schools. We partnered with the Department of Education. So we had access to education officials, we had access to teachers, we took them through a curriculum we had developed, and then they were supposed to go and teach their pupils. So in that sense, we have a bit of knowledge. And then, of course, during our other program, we also had occasion to do a bit of extension. Even when we are strained, we put it as one of our priority items, and nowadays we have what we are calling e-extension, use of SMS. We normally send some messages to, we have profiled most of our farmers, if you could call them so. And so there's a way we communicate with them through mass SMS.
Okay.
So that helps us to reach more people than using the normal extension of. And then finally, of course, we do a bit of few days, and during those few days, we still talk about the issues, including rabies.
Okay. You had alluded on a rabies elimination plan. Maybe you can tell us a little bit about this plan, and when we talk about elimination, did we have timelines in this plan?
Yes, there's actually a global strategy to eliminate rabies, which was developed by a team which is included World Health Organization, included World Organization for Animal Health, FAO. There's an organization called Global Alliance for Rabies Control. So, among other partners, they developed a strategy that aims to eliminate rabies in the world by the year 2030. It's aligned to our vision 2030. And so in Kenya, we have what we call a zoonotic diseases unit, which is a team coordinating zoonotic diseases. Zoonotic diseases are diseases that transmit between human beings and animals. And so we have that partnership between the Ministry of Agriculture and the Ministry of Health. And they led, again, partners in developing the country strategic plan, which is also aiming at 2030 as the year where we should not talk about rabies. It was launched in Makueni in the year 2014, September, during that year's World Rabies Day celebrations. And so the plan looks at several phases, which include a pilot.
Okay.
And so at Makueni we were implementing the pilot. The pilot should give some lessons which should now be incorporated in the rollout in the whole country. But we can't say we have rolled out the whole country yet, but there are still discussions. I hope it will happen. But the pilot was done between 2015 and 2019. We sort of finished that, and we meant our report, lessons learned. Yeah.
Okay. Dr. Mbaire, from research, Is there any research that is going on at the moment focusing on rabies?
Yes, Professor Thumbi Mwangi, he has been spearheading rabies work in the country. A lot of work has been done in Makueni and Siaya County. Those were among the pilot counties that were supposed to be pilot counties for elimination of rabies. It started in 2014.
Mm-hmm.
Yeah. So in Makueni County and Siaya, we've been doing surveillance. So that is following up. So if I'm bitten, I report to the health facility. There is a register there. So that register, I will fill my name there with the bite category. Then I, as a vet working on the surveillance program, I go back, call this patient, go back and do contact tracing. So contact tracing, I want to know if this person was bitten, are they still coming to get their anti-rabies vaccine? And was there any other person that was bitten by the biting dog? Are there any other people in the community? And what is the fate of this biting dog? Is it showing any clinical sign? Do we know it? Has it caused any other bite? Or are we experiencing an outbreak of rabies and we don't know? Yeah.
Okay.
Those works are ongoing right now.
Okay. Dr. Ria talked about elimination of rabies.
Yes.
Is it possible?
Yes.
To me, it is possible.
It's possible. If it's really, like they said earlier, the rabies is transmitted by the dog.
Mm-hmm.
So we just need to remove it from the dog by ensuring we vaccinate all dogs that are likely to get rabies. Where there's rabies, and we do that consistently for at least 3 years. The target percentage is 70%. That is epidemiologically proved that if you cover 70% of all the dogs, which the whole population that is exposed to rabies, then you do that for 3 years consistently, then you will not have the virus circulating in that population. So if we do that now massively in the whole country, and then Uganda, Tanzania, everybody does it, then there are areas which Europe is free of rabies, America is free of rabies.
Okay.
Same process.
It becomes easier for the government to save on cost. You eliminate rabies from the dog, it means I do not have to buy those anti-rabies vaccine. There are 5 doses, which is expensive. If the county is buying it, they are undergoing that cost of buying the vaccine.
Okay.
So if we eliminate rabies in dog, it means they won't have to use that money on buying.
Okay. So in terms of containing these dogs, as you said, majority that we see walking around are still on. From this strategy, how are we going to make me and you contain our dogs at home? Is there a
I want to go first. Maybe I just say it's more on creating awareness. You see, when you tell people what rabies is and what impact it has on both of me and you, myself with my dog, and how it's going to impact on my neighbor, and that becomes, you become responsible. What is the importance of you become responsible on your own dog? That is how we can only contain.
Okay.
Yeah.
And you know, the interesting thing is that not a lot of people know about rabies.
Yeah.
In fact, you'll be shocked by the level of awareness about rabies among human medics and human health workers. It's very low, and it is opportunities like this where we are happy to partner with people like you, because this is information that will surely reach a big percentage of our population.
Yeah.
So what role is KVA doing in rabies control in the country?
KVA, that is short for Kenya Veterinary Association, is a membership association of veterinarians with a dual mandate, mainly on the welfare of their members and the welfare of animals. And in following up on the welfare of animals, we are the flag bearers of the World Rabies Day. KVA always organizes World Rabies Day across the various places in the country. We are organized in branches across the whole country, and so we encourage our branches to do many World Rabies Days, sensitizations. Mainly, the key thing about World Rabies Day is sensitizing people about rabies, about the dangers of rabies, about the options available, about what she talked about, how you need to act when you are bitten by a rabid or suspected rabid dog. So the role of KVA is really that sensitization, that publicity, the awareness creation, and they also support in terms of mobilizing partners to support vaccinations with resources like rabies vaccines. We support our branches so that they also, during their awareness creation, we are also doing a bit of rabies vaccination.
Okay. Do you think we have enough vets in this country to do all this? If not, what are the challenges? Why don't we have enough vets?
I don't think we have enough vets, and I don't think as a country we have made the veterinary profession attractive, and
Yeah.
I think that's one of the reasons why we don't have enough vets, because if you go to a country like USA, a vet is ranked higher than a human medic in terms of what kind of respect they give them, what kind of even payment for services they receive. But here in Kenya, the vet is really ranked low. The ule daktari wa ng'ombe, you know, and even the farmer doesn't want to pay you for services rendered. And then the biggest other challenge in poor countries like ours, this veterinary service should be a public good. Government should provide these services because our farmers are poor, first of all, and secondly, they are not well educated to appreciate this service. So the governments have not really taken up this matter. You realize after devolution, a lot of county governments have not employed vets, they have not employed animal health workers. We are almost 10 years of devolution. Imagine from 2013 to now, how many people have retired, and if they are not being replaced, then yeah, we have a problem.
Okay. Just like the case for those of us who grew up in a farm, we never wanted to be farmers. Okay. So in terms of training of vets, do you think we are doing a good job as a country?
The quality of training is excellent. Our
Okay.
professors are
Intensive.
good. And it's very, actually, like she's saying, it's very intense. There is never a course in this country more intense than vet. There is no, I was in college in the late 80s, early 90s. You used to find every other profession. People are going to 2 or 3 lectures in a day or in a week. Veterinary, you get into class at 8, you leave at 5, you go to Saturday, you do 4th term, very intense. So the quality is good. And our vets are, when they go out, you have heard Botswana is surviving on vets from Kenya. You know, we know vets in USA who are thriving very well. My class, I have like 3 classmates I know who are thriving very well in USA. So our training is excellent. I would say that.
Okay. So how often do we have breakouts of rabies or suspected
Rabies.
rabies cases? Yes.
Rabies, like I said, there are times when you have a lull, then there are times when you find repeated cases, and most of this happens if we have a dog that is rabid, and then it finds itself biting another one which is not vaccinated. So That is why Professor was saying every year you need to vaccinate your dog so that you protect it from rabies. The booster is every year. And that is why we are saying if you could work towards eliminating rabies, you are saving on two fronts. You wouldn't need the booster and you wouldn't need the human rabies vaccine, which is actually very expensive. And that's why a lot of our people have to buy it. It's not provided in most governments.
Okay. There's also a period when it's a mating season and you see a lot of dogs roaming around and they fight a lot. Could that be a contributing factor to the spread of rabies?
It is
After that period
it is a good ground, because if dogs are crowded, if it happens that one is rabid, then it will definitely have more dogs to bite at one central place. But you wouldn't say that is the mating season itself. You wouldn't say it is a contributor. Because if there is no rabbit case, then there is no problem. But then again, and that's why Professor again mentioned about the danger with children, because you find children are going to school early in the morning, and then you find a crowd of dogs. So if you they think you are threatening them, it's likely they will bite you. That's why we have many cases of kids being bitten by dogs. So sometimes the dogs are rabid, sometimes they are not rabid. So it's that situation.
Okay, so as we wind up, what is the theme of this year's World Rabies Day? Dr. Mbairi.
So it's fear, fact, not fear.
Fact, not fear.
Yes. So we want to go out there. We want to create awareness on rabies. We want to tell people what rabies is, what is the impact, what is the consequences if I don't vaccinate my own dog, on the community and to myself. Fear, we want to tell people that yes, rabies exists, but we can control this disease by vaccinating our dogs.
Okay.
Yeah.
And they also need not hide the fact, if you are not sure what could be the matter, you just need to come out. Sometimes people think this is traditional, kienyeji, witchcraft, so people need to just know that rabies is there and come out if you are exposed and you get protected.
Okay.
And
Also,
there's a myth. There's a myth that exists that once you're bitten by a dog, you can just place a charcoal and you're just fine. I think that won't help. Just have to follow the right protocol.
okay.
Yeah.
I also know different communities have different names for these diseases. And maybe when we talk about rabies here, some of them may be wondering, what is rabies? But if it is told to them in a language that they understand, they will be able to identify with it. So I think that's what you do during the World Rabies Days, and that's how you educate them.
Yes, during World Rabies Day, if we're in whichever place we are, like this year we're in Malindi, we'll be talking to them in their local language, in Kiswahili, in English. We also have our own mini World Rabies Day in Makueni tomorrow, by the way. So we'll be talking to them in Kikamba and Kiswahili, and I know our branches like Rift Valley, they are doing something in Narok. I'm sure they will be talking in Kemasai. So yeah, we talk all those rabies names. I don't know how you call rabies, where you come from.
I don't know. I'm not sure if I know the name.
Where I come from, it's called Mungedia.
Yeah.
So
And this awareness is not only to the community, even to the vets and to the human medics. So most of the time, there's this perception that rabies is the disease for the vets. No, that is wrong, because yes, our dogs will have rabies, but it is going to transmit into the humans. So these humans will go to the health facility where they need attention. Okay. If I, as a medic, I do not know how to manage this case of bite, this person might end up dying. And we did a study In that study, we were looking at the awareness and level of knowledge on management of dog bites by healthcare workers. The findings were that the knowledge is so low, yet they need to know on how to manage this case. So when you're doing awareness, it's cutting across the vets, the human medics, and yet their community.
Okay.
Yeah.
Thank you very much, Dr. Kese and Dr. Mbaire, for sparing time to come to be with us today. I also want to say thank you to Professor Kathure, who was with us earlier on. I know our viewers have really learned a lot when it comes to rabies and why it's important for them to take it seriously and make sure that they do what is right and vaccinate their dogs at least once a year. For our viewers back at home, that is it from us today. Until next time, goodbye.